everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This next section has to do with the benefits of owning and opening a women's health clinic. So it's kind of an obvious no-brainer, but I really think it's important for us to address the importance of creating more and more women's health clinics as midwives and nurse practitioners. We are not being served in such an ever-changing healthcare system, not just in pregnancy and birth, but from as soon as we have our period and defined as a woman, as to postmenopausal and all the changes in hormones, that someone really understands us and can advocate. So a woman's health is her capital, and that's just a slogan having to do with a women's health clinic. The benefit of what we're providing is the advocacy empowerment so that we can have a better, healthier society long term. So legal disclaimer we put at the beginning of all of our presentations. This information is for educational purposes only. It's not used to substitute professional, legal, or clinical advice. We try to keep our information as accurate and timely as possible, but it may not be as accurate and adequate for the times in your local unique situation. So the objectives of this section, the student will be able to verbalize the importance of having a women's health clinic in their area, be able to verbalize the fundamental focus of what is a women's health clinic, and all the benefits of running and having a women's health clinic in your area. So why is this topic so important? Essentially, a lot of women are the foundation to their family units, the community, the foundation. If a woman's health is not strong, her family's health is typically not strong. It comes from pregnancy, growing her babies, nursing her babies, feeding her babies, financial access, healthcare access. The healthier a woman is, the healthier her family unit will be, the mentally and physically. So it has a ripple effect to our communities, and being able to provide more and more women's health clinics across the country is definitely something needed. Hospitals are trying to keep up with the ever-influxing demands, and they're shutting down critically access community, offices, facilities. Everything's becoming more and more centralized, and we're losing a lot of opportunities, of barriers to access to care by this centralized healthcare system. So women's health clinics started by midwives and nurse practitioners, we have such an opportunity to shift and adapt so much quicker than a healthcare system can, and we can have a much lower overhead, and needs can be customized to the families and the women in our community. So we're a vital aspect of the country's healthcare system that's immensely growing in needs and demands. We focus on the quality side, we focus on preventative, we try to be cost effective and resourceful with our women's health clinics, and spread on those resources to our families and the women we are serving. So the fundamentals of a women's health clinic, why it's so important. It delivers comprehensive, culturally competent, can be primary care, but it typically is gynecological services. Just depends on your scope of practice and your goals with your service. Some of the services can be offered for whether you have the ability to pay or not. You can choose to set that up with your practice. A lot of practices will have like grants or have low income fee schedules and ways to help bridge access to services. The care is patient integrated and focused. There's unique, diverse needs for the underserved and rural communities across the country. You can set one up in a city, but I'm just saying the biggest thing I'm seeing across the United States of nurse midwives and nurse practitioners starting women's health clinics are bridging those barriers of where there's 2 hours to drive to get a pap smear, or they can't, they're in a waiting list and there's nobody open, and there's doctors and providers retiring left and right in their communities. And so I see rural women's health clinics mostly popping up across the country. You can do it private, you can do it nonprofit, you can do it community owned, you can do it tribal, faith-based, religious affiliation, you can do it with a board, you can do it as you're the single member owner. There's so many structures to a women's health clinic, but the key concepts with it is the foundation of it is to benefit the community of women and figuring out what the needs are and how can you serve. So the benefits of a women's health clinic: in today's ever-changing healthcare system, they're much more adaptable. Compared to a large healthcare organization, you have such an advantage to personalize things and adapt quickly and figure out what the needs are and listen to the women, the families you are serving, versus a bigger system. There's 20 steps and meetings and things change all the time, and it's a very complicated process to make things change for the better and keep up with all the growing changes in our community, being a big system. So women's health clinics that are privately owned by midwives and nurse practitioners are just so adaptable. They have such high satisfaction. They can really serve the needs of their community and the needs of the business owners. I always stress the benefits aren't just for the communities you're serving, but also for the midwives and nurse practitioners that are owning the businesses. You have autonomy. You can choose your mission statement. You can choose who you're going to serve. You can choose which days you want off, versus if you're employed, you have a lot harder time with that adaptability, and you're going to just take whatever patients they put on your schedule and what days and hours they're telling you you're working. So there's a lot of benefits for the moms that are also owning the women's health clinic, not just the clients, patients that you're serving. You can choose to be an urgent medical attention, have some few open clinic days, hours each day from Monday through Friday, 8 to 5, and then on weekends and nights they would seek out ER emergency services. So you can have the ability to not have people wait for a long period until things are more complicated, or the answer of going to the ER urgent care that won't be best for their needs. We can definitely customize and adapt much more quickly to the growing demands and changes than any large-scale healthcare system can. It's far less expensive than going to the ER for families to have something that's more available, cost-effective, personalized care within your community. Having experienced staff, having people that are polite, high quality, their training is top-notch, the receptionists, I mean, to have someone answer the phone that's pleasant and kind and truly cares about you is unfortunately getting lost in our ever burning out healthcare system. So there's a lot of benefits that we can add from the very first experience encounter to when they're at the bedside with the care provider. So there's a lot we can do to support the needs of our community with women's health clinics. Preventative care is the ideal focus, but obviously if there's issues and problems and pain, they would get addressed. But the goal is to really make the women in your community as healthy as possible and support them with educational classes, resources, preventative medicine, sexual health classes, counseling. There's so many opportunities, and just remembering that the nurse practitioner, the midwife, doesn't have to do all of it. They can create an amazing team. They can create a physical therapist, a nutritionist, a diabetes counselor. The list goes on and on. A massage therapist, a spa-like environment. I mean, you could do whatever you desire to really focus on de-stressing women, making them feel empowered, helping them to get as healthy as they can be with your resources being supported. Effective disease management, you could do more of hypertension, diabetes, chronic pelvic pain. You can really determine PCOS. I mean, the list goes on and on of what type of services you would like to offer, and you can help bridge those barriers and access issues, because there's very few people doing infertility and very good at infertility and sexual health that understand alternatives and not just the traditional medical model of serving those management options. And people really appreciate having someone local, down to earth, that old school mom and pop provider office again. Improved quality of care. The research shows getting things more and more local and personalized versus bigger healthcare systems improves the outcomes of care for the families and the patients you're servicing. Focusing on prevention, primary care, gynecological services, pap smears. The insurance company really helps with the Affordable Care Act in counseling, weight loss management, smoking, breastfeeding. A lot of these are covered with the Affordable Care Act. If they become problem visits, it's more towards their copay and deductible. early management of health conditions, being able to be the initial gateway to help them to get a certain specialist and access, because many of them with the big healthcare systems, there's 20 steps to go through, and you need to see this dermatologist, you need to see oncology, but to get in with the person that's the gateway may take some time, and so it can help speed up the care process, giving you greater access to you as a whole person, and then they can advance you to the specialist a little more speedy than some of the bigger healthcare systems can do. So as a conclusion, women's health clinics have immense benefits to their communities, to the people that own them, to the direct families they're serving. You can choose whatever services you want to offer, the style, the time with the visits, the education that's involved, the resources available, the staff training, the flow. You can decide what type of services you want to offer, and the benefits are immense to you and your community that you're serving.